Hello, everyone. I'm Gina Arias, your host, and I'm thrilled to welcome you back to another episode of TM Policy. Today, as always, we are going to be diving into the policy issues that affect moms, children, and families. And I am thrilled to have the amazing, the incomparable Jamie Belsito with us today.
Gina, thank you.
So glad you're here. I'm going to tell the audience a little bit about you. You are the founder and director of policy and partnerships at the Maternal Mental Health Leadership Alliance, which you established in 2019 to drive positive federal policy outcomes for maternal mental health. You have done many, many things, including be a key advocate in the passage of 3 federal laws around maternal mental health. You have helped to secure state and federal funding for many resources for moms, including the National Maternal Mental Health Hotline, which we will talk about a little bit. And you are a former representative in the Massachusetts State House. I have to get my papers together. You are currently the town moderator of Topsfield, Massachusetts, and last but not least, you are a candidate for U.S. Congress, campaigning on a platform to improve the lives of mothers and families. So welcome. Thank you so much for being here.
So excited. Gina, thank you. For the record, I am now the former town moderator. Last week was my that was my 3rd term. But all the rest is definitely on point, and very excited to be here. Great to see you.
Same here. We like to start by letting our guests tell the audience a little bit about themselves, in their own special way. So could you just share a little bit about yourself and how you were inspired to work in this area of advocacy and what grounds your work for maternal mental health?
Thank you for the question. First and foremost, I am a mom of 2. I have 2 young women. One's in 7th grade, one's in 10th grade, and I do this work for them. I do this work for all families, and I came to this work by way of my own lived experience. I had just debilitating mental health complications with my first birth. I had a 3-month miscarriage prior to having my first daughter, and between the time of having that miscarriage to being pregnant with her, I was told that I was at higher risk for having a miscarriage, that I was of advanced maternal age, which put me at risk for having another miscarriage. And I had a very fraught pregnancy with her, and I could not find any support. And come to find out, it's the number 1 complication of all pregnancy. It's the leading cause of maternal mortality is suicide and substance use disorder. And when I take a look at where I live, north of Boston, in one of the best locations in the world to get health care. Adele gets her vocal cords fixed here. The King of Jordan gets his heart fixed here. And I couldn't find any support as a new mom. It really concerned me. I am white presenting, married to a man, had private insurance, live in a home in the suburbs. What did that mean for everyone else? It clearly was a red flag. And come to find out, Black and brown women are dying 2 to 3 times higher rates than white women. Our Indigenous sisters, people in rural communities, folks who don't have access, even a Medicaid extension, people are at risk. Moms are dying. We have the worst outcomes in the industrialized world. So I center my story and the work I've done, both at the State House and in Congress, to say we need to take care of our most vulnerable populations. That's women and babies. And when we have healthy women, and we have healthy pregnancies, and we have healthy children, our society will thrive. And that's how I met you, and I'm so excited to be working alongside you.
That's right. That's exactly how we met. And I'm glad you touched upon the data. I do want to, again, state for the audience that maternal mental health conditions are the most common complication of pregnancy and childbirth, and they affect more than 800,000 women each year just in the United States. we always talk about, we hear about as well, postpartum depression, but there are so many other conditions that moms and birthing folks are facing when they give birth and during their pregnancy, including bipolar illness, anxiety disorders, postpartum stress disorder, and as you mentioned, substance use disorder, and many others. So thank you for, let's get grounded in the data. Let's start with that. So we know that having a child has never been easy since the beginning of time. But could you talk to us a little bit about what moms may be facing in this particular moment in history that could be affecting their mental health?
It's really a lot to process with what moms are working through right now. We have the, again, highest rates of maternal mortality. CDC maternal mortality rates just came out, right, Gina, and stating that the mortality rates went up. I mean, my goodness, to be giving this data, which we need because we need to course correct. We need to understand why we spend the most on our health care, but yet have horrible outcomes, right? A lot of it is closures of L&D, closures of birth centers, lack of midwife care, extreme maternity care deserts, lack of insurance coverage, right? Cutting back of Medicaid insurance, racism, every ism that we can think of. Women's health care in general is subpar access to our care. And then let's talk about something that we know is a huge issue, and that's restrictive reproductive health care laws that are not taking care of women who have wanted pregnancies that are miscarrying. There's a lot of intersectionality between where you live, what your zip code is, what access you have for health care, if there's restrictive abortion care laws, and all of this stress, we're seeing mental health conditions and complications are actually secondary to cardiac, preeclampsia. The other incredibly difficult issues that we see are always in the top three challenges for women in different racial and socioeconomic profiles. So there's a lot for women to be thinking of. And then lack of paid time, leave, right? Lack of child care options, lack of affordable child care options, pay equity, housing, food, you name it. There's so much. It's really a difficult time, I think, to be making the choice to parent unless you have a whole host of support systems and favorites stacked on your side.
So that's why we're here, right? To do this work. And I'd love for you to talk to the audience about what some of the efforts have been, both in the state of Massachusetts and on the national level, to really address the maternal mental health crisis.
So we have this amazing postpartum depression commission, the Ellen Story Commission, that's in the Commonwealth of Massachusetts, that was established in 2009. And at that time, the former state representative, Ellen Story of Amherst, established this commission. And it was under, I think, it's funny, you'll always hear Mitt Romney's name get thrown around, the creator of what's now the ACA or Obamacare. This was also created under Mitt Romney. And it was to bring in insurance providers, both mass health, so Medicaid, and private, as well as public health folks, insurers, doctors, lived experience, everyone to be talking about what is this elephant in the room and why aren't we speaking about it. I was very fortunate to be a commissioner on that, worked very closely with the administration in 2015, 2016 to offer coverage of screening, just to screen for postpartum depression or anxiety disorders, as you said, bipolar, anxiety, OCD. It is a spectrum disorder, right? So we've done that, and from there, we've continued to have the conversation because the racial inequities conversation became a part of that, which then created the Commission on Maternal Racial Health Inequities that delivered a report to say, here's what we have to do in order to create a baseline for everyone to get equitable access and racially and culturally competent. I will say I was very fortunate in the State House to file a workforce pipeline, equity workforce pipeline bill for maternal mental health, as well as the workforce grants for community programs, which we're seeing had been refiled in different iterations and are now actually been signed into law by the governor and just were released into our communities because every community needs them, but we have to start somewhere. And that shows the leadership of this state, which has been rated the best place to give birth and have children. Although, to be frank with you, Gina, our maternal morbidity and mortality rates have also increased here in Massachusetts, and it's something we have to continue to work on.
You mentioned some supports, or maybe I mentioned, or maybe they're just in my head. For example, the National Maternal Mental Health Hotline, those are supports that weren't around when we had our children. I certainly wish it had been. I probably would have used it for sure. So could you talk to us about what, how these policy and advocacy efforts happen? What was necessary to establish something like the hotline and the other supports that we currently have?
I agree with what you just said. You would have used it. I would have used it. So many people would have used it. And it's our power of our lived experience to be able to pivot and move into these spaces with Moms Rising, with Maternal Mental Health Leadership Alliance, with our sister organizations to lean in on these issues. Now, the Maternal Mental Health Hotline was born out of, from what I understand, I can only speak from my side of the street here, my and our executive director, former naval officer Adrienne Griffin, talked about how, she could serve in the military, she could be overseas, she could work for the administration, but she had never been taken to her knees like she had been after the birth of her son. And boy, did she wish that there was someone to call in the middle of the night or during those times that it just didn't seem like the sun was ever going to rise or that we were ever going to get to the next day. And we started talking about it. Okay, what if we do partner with an organization that can help reduce incidences of really tough things like suicide or suicidal ideation or any self-harm, or really trying to de-escalate scenarios around anyone being at what I call code red. Because as we know, Gina, as moms, we're not supposed to have crises, so a lot of the mental health crises will come to a head at code red instead of being de-escalated in the beginning. And this was something that every congressional office that we spoke to on both sides of the aisle in both chambers said, this makes complete sense. And if this is going to de-escalate and allow women to obtain or families obtain services, we should do this. And that was written into law in 2022, and we've now been able to get, I believe it was $10 million this past Congress, 2026, yes. And we're trying to socialize that amongst military and our indigenous communities, and we're asking for another $2.5 million in this year's appropriations.
Awesome. So, part of this work is actually speaking with our legislators. They need to hear from us, regular people. You know that, I know that. However, many people are intimidated by that, by going to ask for something or say something to an elected official. How would you, what would you say to someone that wants to get involved but is hesitant or feels, intimidated by that process? How could they plug in? What can they do?
I really appreciate this question because we've all been newbies in that space before, and it can be intimidating. I'll reflect upon my own challenges as a new mom, because not only did I work through mental health complications once, but twice with both my pregnancies, 2 different types of iterations. One was severe OCD and anxiety, and the other one was severe compulsive disorder and rage, postpartum rage. The thought went through my head was, especially with two, was that there was going to be some sort of penalization for me as a mom if I sought help. So I was very hesitant to seek help because I felt that if I was expressing my need for support, that somehow or other there could be an intervention of police. And I think that we have to acknowledge that a lot of women feel this way, and that some women have been brought up in an inequitable system of foster care, or having been racially profiled, or having problems in their community with police. So I want to be very transparent on that. That can be hesitant, give folks pause. And talking about something that doesn't have to do with posting nice pictures of my baby on Instagram is also another deterrent. I think we've created a wall of social media that shows outwardly everyone's put together. But I applaud the other side of the social media that shows that that's not the truth, and that we can find each other. It does take one voice to make a difference. And if you are supported by folks who can help raise your voice, we've done that at the Maternal Mental Health Leadership Alliance. We have an annual National Day of Action, or an Advocacy Day, where we open up our portal the beginning of every year to say, hey, are you a mom? Are you a clinician? Are you a family member that this is an important matter to? Come join us. We do a training. We put you in a group. We let everyone know. Speak if you want to speak. Don't speak if you don't want to speak. We have amazing leaders like Gina Arias from Moms Rising, so we don't just put you in a group of folks, and this is all online, right? We're in the land of Zoom, so we have folks from Alaska and Hawaii and Maine and Florida, everyone. But it allows folks to not feel alone. It gives them their voice. They get to raise their issue with their congressional representatives, and they're in a safe environment, very guided, with a lot of support, a lot of background, with clear asks. And I would say, again, give it a try. Folks can join us. They can join you. There's other facets they can try or join, even at the state level, right, Gina? I mean, look at what you folks have done at the state level.
That's right. That's right. And I can attest the National Day of Advocacy that MMHLA puts together and organizes is definitely a safe space. I've been a part of it as a, not just someone who's on the team, but also someone who's led teams. And I always tell folks, look, you all are the experts in your lived experience. You all know much more about maternal mental health than the people we're sitting in front of. So just know that. I also reflect back on my first experience years ago in HIV, and it was the first time, so you think, oh, this person's going to know so many things. He knew nothing, this legislator. Wasn't here in Massachusetts. Here, I'm sure they don't know everything, but I was shocked here, right? I was shocked. I said, oh, this is just a regular person that I'm sitting in front of, and I'm giving him information that hopefully he will go and put into policy and law that's going to help us. So that is a fact. Indeed. So now we're at what I call the one thing part of TM Policy, where I ask 3 focused questions as we're coming to the close of our discussion. So, what is one thing that you wish every mom knew about asking for help?
To actually put in a plan ahead of time, talk to the people that are closest to you, and say, because most moms, especially in this country, are used to doing it on their own, or the expectation is no longer, we the people, it's I the person. Everyone's very individualistic, or not living near their family. Put a plan together and talk about it ahead of time. You're going to ask your best friend to say, I'm going to bring a chicken pot pie every week for 3 months, 6 months, whatever it is. That your mother-in-law or whoever it is, I don't care. Put your team together, like 3 to 5 people. And if you don't have those 3 to 5 people in your community, you ask your general practitioner, you ask the hospital, You ask if you have a caseworker for your pregnancy. You ask whomever it is, your partner, your best friend, let's put a plan together. Because you'll probably not ask for the help after the baby comes, but you're going to need it.
Jamie, where were you when I had my son?
Where was I when I had my daughter?
Exactly. We could have used this advice. Sure. My mom she came from the Dominican Republic to stay with me for a couple of weeks. And I never forget when she left after like 2 weeks, just two big tears just rolled down my face. And about 4 weeks later, I just got my son some immunizations, and I said we're going to DR, and I just spent the rest of my yeah. I was like I couldn't. It was too much. I was a single mom, and it was just too much. So I got much better over there. It was great. So yeah, support is man, for me it was everything. So I really appreciate that advice. So, second question. If you could implement one policy tomorrow to improve maternal mental health, what would it be and why?
There would be an embedded mental health provider for every woman who's pregnant at the GP, at the OBGYN, at the clinic, at the pediatrician's office. There would be one community coordinator or a point of care coordinator that would follow that woman, and then also coordinate home visiting programs, checkups, follow-ups, etc. after the baby comes. But there would be a dedicated person for that mom from the time they find out they're pregnant and going through that whole system. And also that person, as I'm talking about this, not just a care coordinator, but if that's the midwife, they're part and parcel of that conversation, and making that just be normalized and covered, fully covered pregnancy care in the same vein. That would be the no one paying out of pocket. We are making a huge social contribution, huge unpaid social contribution that no one is putting any emphasis on how important this is. It should be fully covered care.
I love that. I love that. Okay, for those watching who may be struggling mentally, emotionally, or love someone who is, what's one thing that you want them to know?
Oh, you are not alone by any stretch of the imagination. I can remember thinking, if I just laid in a ditch and let somebody put dirt over me until I couldn't breathe anymore, I would be so much better. And here I am to say, my brain was tricking me. And those thoughts were haunting me. You are not alone. Your family member's not alone. And they are actually just a statistic. They're not alone because it's 1 in 5 that we know report. So it's probably more like 1 in 3, Gina. Right? Like, it is the big bad secret that nobody speaks about. And I would encourage them to use the 1-833 TLC Mama line, 1-833 TLC Mama, call and text. They show that like nanas and grampies and memes and abuelitas and like everyone's calling, and then the partner calls and the mom can call, but anyone can call, text, and you'll be connected with local resources to help you.
Yes, thank you for saying that, because it's not just for moms. It's for anyone who is in the circle of the mom who's struggling, and also that they have counselors also in Spanish, right? That speak Spanish, and I believe there are about 60 other languages that they can get translators for. So don't worry if you don't speak English, or if you know folks who don't. Give them the number, and if they need it, so they can reach out.
And it's not reported. You don't need insurance. It's completely confidential.
Thank you, Jamie. And thank you for joining us today for this important discussion on maternal mental health. Of course, we learned a lot from you, as always. And we also know that, every birthing person, every mom does not yet have what they need to be fully supported, but that's what we're working towards. You shared some wonderful resources. Any key takeaways or final words that you would like to add?
For myself, and I think for yourself, I think for anyone in this space, this is legacy work. Whether it's the Maternal Mental Health Leadership Alliance or me running for office or whatever, we will always be there fighting for families, fighting for women, fighting for children, and we are going to change the way this country takes care of its most vulnerable, and I commit to that until I'm no longer here. And I'm so thankful for joining arms with Moms Rising and working on the issues that we work on. We do need a Bill of Rights for moms. We need to take care of our families, and that is the sign of a healthy society. So let's continue working together.
That's it. Thank you so much, Jamie.
Thanks, Gina. It was great being here.